Welcome to this video on anxiety-linked night urination, also known as nocturia. This resource, developed by Dr. Umesh Bhargava, provides guidance on understanding and managing this condition through physiological and psychological interventions. Nocturia is defined as the need to wake up during the night to urinate, disrupting your natural sleep cycle. Common causes include excessive fluid intake, underlying medical conditions, or medications. The goal is to identify root triggers and implement lifestyle adjustments to restore restful sleep. The mind-body connection plays a significant role in nocturia. Anxiety can trigger a false sense of bladder urgency. This video offers an action plan to calm your nervous system. Always consult a medical specialist to rule out other potential health factors. Let's look at practical strategies. First, calm your nervous system by deactivating the fight-or-flight response. Second, reduce sleep triggers by optimizing your evening environment, such as limiting fluids after 7 p.m. and establishing a bedtime ritual. The core idea is that nighttime anxiety engages your body's fight-or-flight system, increasing bladder sensitivity. We can address this with a two-part solution: reducing anxiety levels and lowering bladder sensitivity to false urgency signals. Here is a 5-step nighttime strategy. Limit evening stimulants. Practice mental offloading. Calm your nervous system, apply soothing warmth, and use bladder reassurance techniques to interrupt the cycle of urgency. Step 1 is a breathing practice. Inhale for 4 seconds, hold for 7, and exhale for 8. Repeat this for 4 to 6 rounds. This stimulates the vagus nerve and promotes a relaxation response to quiet nighttime anxiety. The second technique is bladder reassurance. If you feel sudden urgency, silently tell yourself, "My bladder is safe. It does not need to empty now." This affirmation helps interrupt the anxiety bladder loop. Third, minimize evening triggers. Avoid large quantities of water after 7 p.m. Limit caffeine after the early afternoon, avoid spicy foods in the evening, and skip alcohol at night to reduce urine production. Fourth, use warmth therapy. A warm shower, a warm compress on the lower abdomen, or a warm foot soak can help relax pelvic muscles and reduce sensitivity, which is especially helpful if anxiety is causing muscle tension. Finally, implement a 2-minute mind-quieting ritual. Write down 3 worries before bed, and for each, write, "I will handle this tomorrow after breakfast." This provides closure and helps reduce anxious thoughts. If you wake up at night with urgency, use this 30-second reset. Sit up slowly, exhale deeply, affirm your safety, and wait 30 seconds before acting. Most anxiety-driven urges will fade within this short window. It is important to remember this non-obvious insight. Anxiety-driven urgency is a neurological response, not a physical capacity issue. By calming your nervous system, you can effectively manage these false alarms. While anxiety is a common cause, please remember that symptoms can also be related to other conditions, like prostate issues, sleep apnea, or blood sugar fluctuations. Always consult a medical professional for a proper diagnosis. In summary, you can implement this structured 15-minute routine to create a calming mind-body pattern. Thank you for watching this guide on managing anxiety-linked night urination. Let's begin with the warm body reset protocol. This 3-minute evening routine uses direct warmth to relax pelvic muscles and quiet the nervous system, helping to reduce false urgency signals before you settle in for sleep. The protocol involves 3 simple actions: a 2 to 3 minute warm shower, applying a warm compress to your lower abdomen, or taking a soothing warm foot soak. These methods leverage heat to ease physical tension. Why does this work? Applying warmth helps decrease sympathetic nervous system activity. By relaxing the pelvic floor muscles and calming this nervous response, you can directly lower bladder sensitivity and urgency sensations. Next, we have the anxiety bladder breathing technique. This powerful 4-7-8 method is a structured pattern designed to regulate both your nervous system and bladder responsiveness through controlled inhalation, holding, and exhalation. Follow this pattern. Breathe in quietly through your nose for 4 seconds, hold your breath firmly for 7 seconds, and sigh out completely through your mouth for 8 seconds. Repeat this for 6 cycles, taking about 4 minutes. This works because the long, slow exhale activates the vagus nerve. This activation decreases bladder sensitivity, helping your body shift into a calm state where false urgency signals are less likely to disrupt your rest. Our third technique is the bladder reassurance mind cue. This 1-minute cognitive exercise is designed to interrupt the anxiety loop that frequently generates a false sense of urgency at night. Begin by saying this silently: My bladder is safe. It does not need to empty now. Repeat this statement slowly 3 to 4 times, then pause for 1 minute to allow the false sensation to fade. This technique is effective because anxiety often misinterprets normal sensations as danger. Conscious reassurance effectively breaks this cognitive threat loop, preventing the brain from triggering an unnecessary urge to urinate. The fourth technique is mental offloading. Your brain often triggers nighttime urination because it is scanning for unresolved problems. This 3-minute evening routine helps provide your mind with the closure it needs to rest. Write down 3 specific worries or tasks. Follow this by telling your brain, "I will handle this tomorrow after breakfast." This formal deferral signals to your mind that the work is finished, satisfying the need for resolution. Giving your brain this cognitive closure leads to fewer nighttime anxiety spikes. When your mind feels secure and settled, it sends fewer stress-based signals to your bladder, resulting in deeper, less interrupted sleep. The fifth technique is the body stillness practice. This 2-minute physical technique trains your bladder to stop reacting to anxiety. Find a comfortable position to sit or lie down, and commit to remaining perfectly still. While staying still, slow your breathing deliberately to calm your nervous system. Observe any urge to urinate, but simply let it fade away without reacting to it. This teaches your body that urgency is not equal to danger. By practicing this stillness, you are systematically dialing down the body's automatic panic response. It is a powerful way to decouple your physical reactions from the sensations of urgency that often keep you awake. We have covered several techniques for managing anxiety-linked night urination. Now let's look at how to structure these into a daily evening ritual that you can easily integrate into your routine before bed. The first phase is the pre-sleep setup, occurring 2 hours before bed. This includes stopping fluid intake, dimming lights to support your natural rhythm, and completing your mental offloading to clear your mind. The second phase is the physical soothing sequence, just before sleep. This is where you apply the warm body reset, using heat to relax your pelvic muscles and signal to your body that it is time for rest. Finally, the third phase is the bedtime integration, performed right as you lie down. This includes the anxiety bladder breathing technique and the bladder reassurance cue to settle your mind before sleep begins. Consistency is vital. By repeating this routine nightly, you help retrain your nervous system. Over time, these actions become an automatic signal for your bladder and mind to remain calm through the night. It is also useful to monitor your progress. Keeping a simple sleep log for 2 weeks can show you which techniques are working best for your specific patterns and help you refine your nightly routine. If you wake at night despite these efforts, don't be discouraged. Apply the 30-second reset immediately. Staying calm is more important than achieving a perfect night right away. Always remember, the goal is to decouple urgency from anxiety. Your nervous system is capable of learning that nighttime is for rest, not for responding to every signal your bladder sends. Throughout this process, patience with yourself is essential. Neural rewiring takes time, and your body needs consistent practice to adapt to these new, calming patterns. Should you experience significant changes in symptoms, or if they persist, please re-engage with your healthcare provider. Your safety and overall health remain the primary priority. Thank you for joining this exploration of anxiety-linked night urination management. By understanding these systems, you are taking a significant step toward reclaiming your nights and improving your quality of life. We hope this resource has provided you with actionable, evidence-based tools. We encourage you to share these practices with others who may also be seeking ways to improve their sleep and well-being. For further information and to explore more health resources, please visit the links provided on screen. We are grateful for your attention and dedication to your health. Take care on your journey toward better rest, wishing you peaceful and restorative nights ahead.